What age to begin reproductive cancer screening? What age should you start reproductive cancer screening? This is an important question for many. Let's break it down, focusing on cervical cancer screening, testicular cancer, and other reproductive cancers. For cervical cancer screening, the current medical consensus is clear. Individuals with a cervix should begin screening at age 21. This recommendation holds true regardless of sexual activity. Before age 21, screening is generally not advised. Once you reach ages 21 to 29, the typical approach is to have a pap test every 3 years. As you transition to ages 30 to 65, there are several screening options available. You can continue with pap tests every 3 years, switch to high-risk human papillomavirus testing every 5 years, or opt for a combination of both tests every 5 years. After age 65, if you have had adequate prior screenings and no high-risk factors, you may stop screening altogether. These guidelines are supported by major health authorities like the U.S. Preventive Services Task Force, the American Cancer Society, and the American College of Obstetricians and Gynecologists. Now let's talk about testicular cancer. For men, routine screening for testicular cancer in those without symptoms or risk factors is not generally recommended. Instead, awareness and self-examination are encouraged, especially for males aged 15 to 35, as this group is at the highest risk. If a man has specific risk factors, such as a history of undescended testicles or a family history of testicular cancer, he should discuss personalized screening options with his healthcare provider. When it comes to other reproductive cancers, like ovarian or endometrial cancer, there are no standard screening recommendations for individuals at average risk. Screening is usually reserved for those with high-risk factors, such as genetic predisposition, and should be guided by a healthcare professional. To summarize, cervical cancer screening begins at age 21, with different intervals and methods based on age. Testicular cancer screening is not routinely recommended, but self-awareness is key starting in adolescence. For other reproductive cancers, screening is individualized based on risk factors. Always consult with a healthcare professional for personalized advice and to assess your individual risk.